In this lesson, we will talk about the types of community health assessments: comprehensive, focused, and rapid. Community health assessments. CHASAs are essential tools for identifying health needs, disparities, and resources within a population. Depending on the scope, purpose, and urgency, CHAS can be categorized into comprehensive, focused, and rapid assessments. Each type serves a distinct purpose and is tailored to specific contexts. 1. Comprehensive Community Health Assessment Definition. A comprehensive CHEA is an in-depth, broad evaluation of a community's health status, needs, and resources. It examines a wide range of factors, including demographics, health outcomes, social determinants of health, and community assets. Key features: scope covers all aspects of health, including morbidity, mortality, quality of life, and environmental factors. Data sources utilizes both quantitative, e.g., health statistics, surveys, and qualitative data, e.g., focus groups, interviews. Time frame requires significant time and resources to complete. Purpose provides a holistic understanding of community health to guide long-term planning and policy development. The MAP, Mobilizing for Action Through Planning and Partnerships framework, encompasses 4 key assessments: community themes and strength, local public health system, forces of change, and community health status. However, it is resource-intensive, requiring significant funding, time, and workforce, which makes it challenging to implement effectively in low-resource settings. A focused community health assessment, CHA, targets specific health issues, populations, or geographic areas, offering a narrower scope than comprehensive assessments. It uses targeted surveys, interviews, and secondary data to provide actionable insights on specific challenges, such as diabetes prevalence in rural areas or barriers like transportation and affordability. While faster and more targeted, its limited scope risks overlooking broader systemic issues, requiring precise identification of the target population or concern. A rapid community health assessment, CHA, is conducted in response to urgent situations like public health emergencies, natural disasters, or disease outbreaks, providing quick, actionable data to guide immediate interventions. Its scope is limited to urgent health needs and immediate risks, using readily available data, rapid surveys, and observational methods. Completed within days or weeks, it supports emergency response, resource allocation, and short-term planning. For example, during the COVID-19 pandemic, Rapid CHAS assessed the availability of hospital beds, ventilators, and PPE in affected areas. However, the urgency and time constraints limit its depth and scope, often leading to gaps in comprehensive data validation or long-term applicability. Despite these challenges, it is a critical tool for addressing time-sensitive health crises effectively. Community health assessments can be categorized into 3 types: comprehensive, focused, and rapid, each serving distinct purposes. Comprehensive assessments have a broad scope, addressing overall community health for long-term planning and policy development, often taking months to years, such as using the MAP framework. Focused assessments target specific health issues or populations, like assessing diabetes prevalence in rural areas, and are completed within weeks to months. Rapid assessments are urgent and time-sensitive, conducted within days to weeks to guide emergency responses and short-term actions, such as evaluating COVID-19 resources. Each type is tailored to meet specific health priorities and timelines. The type of community health assessment chosen depends on the context, resources, and goals. Comprehensive CHAS provide a holistic view for long-term planning. Focused CHAS address specific health concerns, and Rapid CHAS guide immediate responses during emergencies. Each type plays a critical role in improving community health and ensuring that interventions are tailored to the needs of the population. Setting: a rural community health center. The staff at a rural community health center, Healthy Horizons, has noticed several health challenges in the area, including increasing rates of diabetes, limited access to clean water, and a recent outbreak of a waterborne illness. The team is deciding which type of community health assessment CHA to conduct based on their situation. A comprehensive CHA supports a 5-year health plan, gathering data on chronic diseases, nutrition, care access, environmental risks, and social determinants. Using surveys, focus groups, and leader interviews, it identifies key issues. Outcome: a detailed roadmap guides long-term health programs and resource allocation for community improvement. A focused CHA targets diabetes as a growing concern using surveys, interviews, and data on barriers like limited care and food access. Findings lead to a diabetes education program and mobile clinic. A Rapid CHA addresses a waterborne illness outbreak, assessing risks and needs to allocate clean water, deploy health workers, and prevent further cases. Healthy Horizons shows how comprehensive, focused, and Rapid CHAS address long-term planning, targeted issues, and crises, ensuring effective responses to the community's evolving needs.